The distance from the chin to the neck itself is short, and because of this, the boundary between the neck and the chin becomes unclear, making the double chin look very pronounced. A lot of bone resorption also tends to occur. So in fact, when a large implant is inserted, or in cases of severe short chin tip, there is a procedure called chin advancement surgery. Hello, this is Dr. Dongpil Jo from AB Plastic Surgery Clinic. Today, I'd like to talk about short chin tip. In actual clinical practice, I see more patients with short chin tips than you might expect. And there are quite a few people who actually don't realize that they have a short chin tip. Also, many of the symptoms caused by a short chin tip are often addressed without correcting the chin tip itself, and there are actually quite a lot of people who try to fix it using other methods. There are far more of them than you might think. So today, let's take a look at short chin tip and discuss what is the best way to address it. When you have a short chin tip generally refers to when your chin is small and set back compared to the rest of your face. If the condition is severe, people often recognize themselves as having a short chin tip. When you have a short chin tip, the muscles at the front of the chin can sometimes become enlarged as a compensatory reaction. Because of this, the short chin tip can be hidden, and many people may not even realize they have a short chin tip. So just having a small chin doesn't necessarily mean you have a short chin tip. As a result, if the lower jaw is set back, or if the chin is small, it can make the teeth appear to protrude forward. These kinds of symptoms can be observed. So for people with a short chin tip, it's common for the chin to be small and set back, and for the teeth to protrude forward. These are the typical features that are generally seen. The biggest factor is genetics. If you look at your parents or even your grandparents, there are cases where they have a short chin tip, and these traits can be passed down genetically. So you can end up with a short chin tip as well. Also, during childhood, improper lifestyle habits during the growth process, such as thumb sucking or sleep disorders, these can also cause a short chin tip. Additionally, problems with the alignment of the teeth themselves can also lead to a short chin tip. If the lower jaw is too small, or if there are issues with the number of teeth, various factors can affect the growth of the jaw itself, and this can also result in a short chin tip. Also, as we get older, our bones actually become weaker, and as the bones become thinner, like with osteoporosis, phenomena similar to a short chin tip can also occur. So, the causes of a short chin tip are actually quite diverse. As for the effects of a short chin tip on the face, the most significant effect is that the mouth appears to protrude, which is the most commonly observed phenomenon in people. Because the chin is small and set back, the mouth inevitably looks more prominent. Also, since the chin is small and receded, the distance from the chin to the neck is short, and as a result, the boundary between the neck and chin becomes unclear. The double chin appears to be very pronounced. So when you look at the overall appearance, the face tends to look rounder and the chin appears shorter, which can give off a somewhat unsophisticated impression. And these kinds of feelings may also arise. Generally, we can improve this with procedures like fillers or sometimes through fat grafting, which is another possible method. Usually when we perform these kinds of procedures, patients sometimes mention that the filler disappears or that the fat graft does not take well, so we may also perform chin implant surgery. However, for those whose short chin tip is not severe, it doesn't really have a significant effect. But for those with a very pronounced short chin tip, bone resorption and similar issues can occur quite frequently. In fact, when a large implant is used, or in cases where the chin retrusion is severe, there is a procedure called chin advancement, where the bone is moved forward, and I would recommend this surgery to improve a short chin tip. If the degree is mild, an implant is usually sufficient, but if the condition is more severe, or if the front to back length of the chin is too short, there are also many cases where functional problems arise. For example, sleeping with your mouth open, or having difficulty keeping your mouth closed in daily life, or suffering from severe sleep apnea or snoring. In these cases, it's not just about appearance, but also for functional reasons. Genioplasty is preferable to chin implant surgery. There are many more advantages. Today we looked into the causes and solutions for a short chin tip and the symptoms that appear. We've discussed these topics today. Next time I'll be back with an even better topic. Thank you for watching.